Voters across Texas cast their ballots as primary election day is today. Victoria County is now under a burn ban, and the Nueces County Medical Examiner's Office cut the ribbon for its multi-million-dollar facility upgrade. This is South Texas Midday. I'm Rob Boskamp. Thank you for joining me on this Tuesday, March 3rd. Voters were up early today, making their way to polling places around the area to take part in the Texas primary election, an election that has the possibility for some interesting outcomes. KEDT's Lon Gonzalez has more.
Polls opened right on time this morning as primary election voters headed out to exercise their rights at the Deaf and Hard of Hearing Center on McCardle this morning. The line of people going in to vote was ready when those doors were opened. One of the candidates in a hotly contested primary race in Congressional District 34 was at the polling place, putting some signs up at the location. Keith Allen, who is one of 8 Republicans seeking a chance to represent the area in a new voting district, had some time to talk about his chances. The first-time candidate outlined the possibility.
I think we entered this thing with integrity. We've run a really good race, and regardless of outcome, we walk out with the integrity we walked in with. I feel really good about how this is going to end up.
With so many candidates in the Republican side, a runoff is well predicted, and Allen feels his chances are good should he somehow get the votes that he needs.
I'm hoping for a top 2. And then if I make the runoff, nobody beats me.
That's Keith Allen, one of 8 Republican hopefuls in the Congressional District 34 race. Polls will remain open till 7 p.m. For KEDT News, I'm Lon Gonzalez.
Victoria County officials have implemented a burn ban as drought conditions worsen across the state. 25 News Now reports the ban was put into effect during Monday's Commissioners' Court meeting after the county fire marshal recommended it out of caution. Violators of the burn ban could be fined up to $500. The county's Keach-Byram Drought Index has reached an average of 500 to 700. The index based on dry conditions can reach up to 800. Other counties in South Texas are currently in the higher levels. Most of those counties, if not all, already have a burn ban in place. Victoria City Council meets today at their council chambers at 5 p.m. Victoria Housing Authority Program Executive Director Tammy Emerson will present an update on the authority program. 2 items on the agenda with public hearing will focus on the city's proposed stormwater drainage utility fee. Other items on the agenda include reviewing an $844,000 agreement with Civil Corp for topographic surveying and final design for the North Street Phase 3 project. Victoria City Council meets on the first and third Tuesdays of each month. Meetings are live streamed online at victoriatx.gov and on YouTube at Victoria Texas Videos. On a separate note, Corpus Christi City Council meetings will resume on Tuesday, March 17th. The Nueces County Medical Examiner's Office celebrated the completion of its newly expanded facility. The $7.5 million project renovated the building to modernize operations and improve staff working conditions.
One of the things that we offer now in this new building are LED monitor screens above each autopsy station. That's something that we've never had before. This allows the doctor to be able to see real-time x-ray scans of the patient she's working with. Additionally, she can view scene photos and the report from investigators.
That was Joseph Hayen, Director of Operations at the Medical Examiner's Office, speaking with 3 News. As part of the project, the original building is set to be renovated to become the office's future administrative headquarters. Law enforcement in Austin say they still haven't identified a motive for the shooting that left 3 dead and more than a dozen injured at a popular bar on Sunday morning. KUT's Andrew Weber reports.
Police fatally shot Ndiaga Diagne after he allegedly fired indiscriminately into an Austin bar. Police said Diagne did have a shirt featuring pro-Iranian messaging, but FBI Special Agent in Charge Alex Duran said investigators are still sifting through evidence.
We want to make sure that we have our facts 100% correct, because that's what we owe to the victims, right? That's what you guys want answers for, but more importantly, we owe that to the victims and their families.
14 people were injured in the shooting. 2 college students died. For NPR News, I'm Andrew Weber in Austin.
Reports of the flu across Texas have decreased in the week ending February 21st. The Department of State Health Services reports 2 influenza-associated outbreaks in that same time period and an additional pediatric death. Over 4,100 Texans have died of pneumonia or influenza since late September, including 7 children. RSV-positive cases decreased slightly in the week ending February 21st, and COVID-19 cases decreased by nearly 8%. 37 COVID-related deaths were confirmed in Texas in the week ending February 21st. And the pandemic may have passed, but COVID-19 continues to have an impact. New research has tied the virus to an increase in deaths from heart failure. As part of KERA's Vital Signs series, cardiologist Dr. Asesh Parikh with Texas Health Plano and Texas Health Physicians Group explains to Sam Baker what's behind the increase.
COVID itself has been linked to what's called myopericarditis. It's a virus that affects the heart muscle, so it can weaken muscle strength of your heart. But luckily, those are very, very minimal in percentage. In COVID, what most likely happened is that patients and population in general was not getting the care, being in isolation, because of the pandemic, social distancing, etc. So a lot of patients that had bad diabetes or say high blood pressure or they had chronic kidney disease, they just didn't seek care with their doctors and specialists, and their conditions essentially got worse. And those same risk factors then led to them having congestive heart failure, hence the rise in the number of deaths. I think it was gradually decreasing for years until we saw the increase since 23 to 24.
Why have younger adults and Black Americans been affected most by this?
Usually that's because of the socioeconomic demographics of where patients live, as well as, again, the clinics and the doctor's offices in those particular areas. A lot of doctor's offices and unfortunately rural areas where virtual visits became a thing that we started doing during COVID. A lot of doctor's offices had to just close their locations. And also young patients, just, I guess you can include myself, we always feel like we're healthy until we're not. And so the mindset also is there that we don't necessarily need to seek care, but in reality, it was negatively affecting their health sort of all along because they were not being able to control their diabetes or get medicines for their blood pressure, or they had kidney disease, which are probably the three most common diagnoses in terms of even prevalence are seen higher in percentage in African Americans and younger patients these days is the chronic kidney disease, is hypertension, and diabetes.
When you let that much time pass, can you really counteract the damage that has been done?
To an extent, you can, especially if you catch it early enough, but to a certain extent, you cannot. So it's very case by case on how a patient might present with congestive heart failure. And if you can get on medications, then as long as you can control your diabetes, your blood pressure, kidneys, and if that's something that can be done by medication, then yes, it is reversible for sure. But if you do have a weakened heart where your heart strength itself has become quite weak, then that is something that I would say about a third to 50% of the time becomes unreversible.
So it is possible that congestive heart failure can be managed?
Managed, yes. So there's
cured.
Two kinds. It's not cured, exactly right. Now, there's two kinds of congestive heart failure where someone's heart sort of weakens, but the heart overall is still strong, but it cannot relax properly. And then there's the other kind where the heart itself just cannot squeeze and it loses the ability to pump the blood forward. The better kind, if you will, is the heart where it's still strong, but the relaxation is impaired, which usually is correctable by treating the underlying cause, aka diabetes, blood pressure, etc.
What steps should you take to avoid heart failure?
Being proactive always, of course, is the number one step that anybody can do. And especially if you have other comorbidities, then definitely your regular visits with your family doctor, make sure that your blood pressure, your diabetes, if you are, a smoker, etc., just you control those risk factors. There's also a blood test called a BNP that can be ordered sometimes to assess if you're retaining fluid. That's the first signs or precursors for congestive heart failure. And getting an EKG done, especially once you're over the age of 40. EKGs can also a lot of times clue you into saying something is not right with your heart efficacy.
Dr. Asesh Parikh is a cardiologist with Texas Health Plano and Texas Health Physicians Group. And that is the latest news and information on South Texas Midday. I'm Rob Boskamp. Your community arts calendar and more is on the way.